Welcome to the Orthodentistry Today podcast. I'm your host, Dr. Dan Gurman, an orthodontist on a mission to help general dentists confidently bring orthodontics into any practice model, from solo offices to enterprise-level organizations. Orthodentistry is the future of comprehensive care where general dentistry and orthodontics collaborate. Get ready for expert insights, real-world strategies, and powerful innovations to drive excellence, predictability, and profitability in your practice. Let's dive right in. I'd like to welcome an extraordinary guest today, Dr. Deanna Skowronski. She is barely 1 year out of dental school and has already started over 40 orthodontic patients. She happens to embrace a favorite philosophy of mine, and that is that the heart of the matter is the matter of the heart. Deanna puts her heart into everything she does, and I believe it is the secret to her success. Deanna, welcome to Orthodentistry Today. It's great to have you.
I'm happy to be here.
Fantastic. So I happen to know a little bit about you. I've actually been to your office and seen firsthand and seen where the magic occurs. I know that there's a story that precedes your entry into dental school. Can you tell us a little bit about what you did before dental school and how you ended up there?
Yeah, so come from a huge family of dentists. My dad is a dentist, his sister's a dentist, my sister married a dentist, my mom's sister's a hygienist, her daughter's a hygienist. So big family there with the passion of dentistry. I was that kid that begged my dad to take me to work with him. I loved being around his patients. I loved watching him share side. And then I started working in the office and realized that I wanted to go to dental school at a pretty young age. So went to University of Detroit Mercy, have a bachelor's in biology and American history, got my master's shortly after. And then I applied to dental school and was waitlisted twice. At that point, I said, oh, okay, what am I going to do? So I actually ended up applying to law school, med school, and nursing school, got into all three, wasn't passionate about any of them, and said, you know what, I'm going to try one more time. And I ended up getting into NOPA, and it was the best thing that ever happened.
I bet you learned a lot along the way.
I did.
So now you're in dental school. You've already got a pretty good foundation of knowledge in dentistry. Tell us a little bit about what happened after you graduated.
After I graduated, my dad had a pretty big practice in Sterling Heights, the Metro Detroit area, and he unfortunately had some health issues. And so I kind of had to step into the practice, and it was heavy ortho, heavy TMJ, and then just bread and butter general dentistry. So I had to get up to snuff pretty quickly. So when I came back from Florida, I stepped right in, and with Ortho Brain and your mentorship, a great successful year.
Fantastic. And having spent a year, are you officially at 1 year? I don't know when
Yes.
you had your license.
Yes.
It was right about now.
I'm 1 year out.
So you're a year out. As all of our listeners know, going to dental school is very expensive. Whether you borrow the money or you have support from family, however it's paid, it's a huge, huge number. From your perspective, was the investment worth it?
I think so. I mean, like you said, heavy financial burden, no question. But for me, I have this plaque in my office. It's a quote by Mark Twain, and I look at it every day. And he says, if you find something you love, you never work a day in your life, right? So for me, I was passionate 100% in, knew I wanted to go to dental school, knew I wanted to run my dad's practice, and nothing was going to stop me. So I would tell people to make the financial investment, but make sure that you're truly passionate about the profession. Because if you have to work so hard, have that delayed gratification, it's going to be miserable. And your patients don't deserve that. And life is too short. So whatever they do, just make sure you're passionate about it.
So that really begs the question, what is it about dentistry that makes you so passionate? It's so easy to see. Anybody that meets Deanna will know that she is filled with passion to capacity. Tell us what it is that you find most appealing.
I would say it's two things. First and foremost, it's the patients. My dad has this great, thriving family practice. A lot of this is third generation that we're seeing these patients. So the lasting relationships that he's had that I'm continuing to cultivate, it's great. I feel like I go to work every day and talk to lifelong friends. The other thing is the problem solving aspect. I get patients every single day that have an issue that needs to be solved, whether that's ortho, whether that's a toothache, or whether that's just aesthetically they're not happy with something. So I love being able to have that conversation, have that dialogue with them, and be able to solve their problem.
It really makes sense. Your answer seems spot on given what I've seen as you interact with your colleagues, your classmates, your professors when you were in dental school. I actually visited the dental school and was a speaker at one time. And maybe, Deanna, you'll tell us a little bit about that at some point. What I noticed is that your success is probably a direct result of you understanding that you are in the people business, that you're caring for precious people. And I know it's one of the things that we hammer home, and that is if somebody wants to become a crooked tooth straightener, OrthoBrain is not the right solution for them,
Right.
right?
Sure.
There's a precious person that's attached to each malocclusion, and that's who we're caring for. Caring meaning how we provide the treatment as opposed to exactly what it is all the time. Would you say that's a fair way
Oh,
to describe it?
absolutely, 100%. The biggest thing that I think that I even learned this past year is I would consider myself a decent listener, but when you're actually practicing and you're interacting with patients, I really, really make a conscious effort to dial in and listen and focus on what they're telling me, because that truly plays a role in how successful the case outcome is going to be.
In terms of operating this practice, and you have a thriving practice, I've seen it. How do you feel with the business side of dentistry? Has that been challenging for you to learn?
I was kind of in a unique situation. I worked in the office on both the clinical and the business side before I even went to dental school. So I had a little bit of an advantage there. And we are a true family business. My mom played an active role in the practice for 40 years, doing all the books and the payroll and all of those kind of things. So I was exposed to that pretty consistently and felt comfortable with that. There are things that I constantly learn every single day, new things. And I always am never hesitant to reach out if I have a question to the network of people that I'm affiliated with. So that always helps. But, it can be daunting at times for sure, because again, I have a larger staff, but it's good for the most part. It's a good challenge, at least.
Yeah, so it makes me wonder who your go-to resources are when you do have questions and you're going to go outside the family. In other words, if you want some input, you want some coaching and advice, tell me how you find that and where you go for some of that.
So I want to say probably about 8 or 10 years ago, and I think you know the gentleman, Bill Blatchford. Does that name ring a bell?
Yeah.
He's very into consulting and coaching for dental practices. And now one of his consultants, who has her own company, Nancy Granahan, has helped me tremendously. She's helped me establish systems in the office, protocols in the office, how to block book, target projections, reviewing reports, and so on. So she's been an invaluable resource for me.
Would you suggest that our colleagues engage some outside expertise to help operate their practices and put
Definitely. I will say there's tons of different consulting firms, and a lot of them can be very expensive. You have to do your research. You have to find one that's going to align with your beliefs of business and your practice management and how you care for patients. I remember it took my dad a long time to find something that aligned with how he operated, but once he did, it was a slam dunk.
occasionally I'm asked, what is my biggest regret about my clinical career? What do I wish I had done differently? And my answer is I didn't engage outside experts
Yeah.
until I was really far along in the practice. And I believe that was the biggest mistake that I made in my career. So in other words, getting the clinical education was always on top of that. Engaging outside experts and learning how to outsource the development of some of the systems, it was a mistake. I ended up spending
Sure.
too much time when I could have been doctoring, building systems. And I believe that a lot of those questions have been asked and answered by real experts on how to do that.
And it's one of those things too. You don't have to reinvent the wheel, right? I mean, those processes, they're tried and true. So once you do find that company or person that can help you establish that for the betterment of the business, your life will be so much easier.
Yeah, well, it sounds like you've built a great recipe for success as you've launched your career and it's gone really well for you. Tell me about the experience some of your classmates have had that are also finding success. Are there some pearls that you can share for those that are getting their careers going? Things that you see your classmates doing that's working really well?
Definitely. So a lot of my classmates are obviously from Florida. So a lot of them work for corporations, which for the most part, they are enjoying tremendously. Just being newly out, having that mentoring built in, having the business resources available to them, even like the CE and whatnot. So I have kind of learned from them how to potentially choose CE classes, find areas of interest to expand my knowledge and dental exposure. So that's been pretty helpful.
And how do you stay connected with them?
So I'm very fortunate. I have a very small group of classmates from dental school. There's probably about 5 of us, and we talk every day. We have a group chat, and we always joke it's kind of a safe space, non-judgmental area where we ask each other anything. And we use it to learn, right? If I have a patient that's in my chair that I've never seen this or vice versa, we have that conversation. And there are times that we even pick up the phone and chat, shockingly, but the majority is through text or FaceTime.
I'm curious, when you went to school, how much time was spent learning practical orthodontics? When you graduated, did you feel that you learned how to practice some orthodontics at any level?
Unfortunately, no. That's not the fault of the school. That's just what the climate is of orthodontic education in pre-doc. So we learned the anatomy, we learned growth and development, we learned how to trace a stuff and things like that. We learned very minimal wire bending. The one great thing about Nova is they do have a PG department for ortho. So if you were interested in learning more, you could go upstairs and shadow the residents, and we were able to engage that way. But enough to practice, no, that was not there.
Somehow we met. I just remember getting this message, and it might have been a phone call. It could have been a text. I don't remember how you reached out to me, but it was, hey, would you come to Nova and put on a seminar?
Yeah.
And I don't think in my entire career I've ever said no to a request to go to a university and teach. I've never said no. I'm curious, how did you find out about us? How did you know to reach out to me or to OrthoBrain? And I don't remember which one you reached out.
Yeah. So I was a D2, and I was actually a guest student at the aesthetics course at the lab that you have. Dental ceramics is in the same building as you are. And it was the second day of the course, and you get up there and you were so charismatic and you're talking about OrthoBrain. And I remember, "Oh, I really like him. He seems so passionate about this." So I went up to you, and you probably don't even remember this. I went up to you after and I said, "I'm a dental student. This is so cool what you're doing." And you gave me your card and I tucked it away. And then I became a D4, and the students were wanting to learn more about liners and brackets and things like that. And I pulled the card out. I called you and you didn't say no. You got on a plane and you came down. And it was one of the most attended CE classes for pre-doc we've ever had.
Well, I had a blast. I met some amazing doctors. And so I've never regretted going to school at a university or residencies. I appreciated the opportunity.
Well, they loved you. So it was great all around.
Well, thank you. Appreciate that. And obviously, it led to you being able to do the orthodontics, and getting 40 cases going in a year is really quite phenomenal. 12 months after getting your license, you've already hit that milestone. So, if it's okay with you, I'd like to ask you a few questions about
Of
ortho.
course. Yes, of course.
So, tell us, when you patients going through hygiene and restorative, are you looking for anything in particular, or are you waiting for your patients to inquire about orthodontics? How does this all happen?
So it's pretty organic because I never want people to think that I'm trying to sell something to them. I have a great team of people in my office. Honestly, I don't know if I would be as successful as I am without them and their support. So shout out to my incredible team. But there's two things. One, if it's a young child, especially before the age of 8, like 6, 7, we're already kind of talking about early interceptive ortho. We're doing the digital scan automatically. That's not something I charge for in my office. It's just part of their hygiene visit. And we're talking about what that's going to look like, if it's going to be a comprehensive case, phase 1 or phase 2. We talk about the airway involvement and so on. And then on the other side of that, I have a lot of patients who maybe have some ortho relapse, crowding that's happening that you can kind of tell they're a little self-conscious about, but they may not want to bring up. So we just say to them when we're reviewing their health history, "Are you happy with the way that your smile looks? Do you have any different goals that you'd like to achieve?" And that kind of starts the conversation. And then by the time I get in there, it's already, "How many trays do I need? I really want this straight. What is that going to look like?" So that's kind of how we do it.
Well, it sounds like you're leveraging the scanner. And are you
Yeah.
right? So are you making a scan once a year, or are you making it every hygiene appointment? How often are you making scans?
Typically, I would say we do it once a year for them. I have a Trio scanner and I'm not paid to endorse it or anything like that, but I absolutely love it. It's incredibly user friendly. It's great in edentulous cases. It's great with the kids. And my team members have a real ease in capturing the information that I need. So typically, we try to do it at every hygiene visit for sure.
It's brilliant. And we hear
Yeah.
this in the top performing practices. This is what they do.
Yeah.
They integrate that as part of their workflow. And like you said, you're not selling, you're educating.
No. And it's one of those things too, maybe 10, 15 years ago, you take models, right? It's a tray, it's alginate, it's the stone to pour it up. There was a lot more overhead where this is a quick 30-second thing and it's done. So there's an ease to it for the patient.
Right. And I think what Dad would tell you is that before we had all this imagery, it was a conversation. And
Yes.
what we found is that people retain and understand visuals much more than they do the talking points.
In our office, I don't charge for records. And I think I told you this as well. I always tell the patients, we're happy to get the scan, the x-rays. Our records appointments are probably 20 minutes, if that, where when my dad was doing film and the actual impressions, they were 90-minute appointments. So you had to charge for them, right? So that's also, I think, appealing to the patient as well.
Well, you made reference to two-step orthodontics where you're intercepting problems in the mixed dentition. And I'm wondering, do you have a treatment philosophy? I know that airway is a part of it. You mentioned airway, you mentioned interceptive. Do you have kind of a philosophy when it goes with the orthodontics?
That's tough because with these kids, especially the younger that they are, I think the easier it is. And we typically get a better outcome with that because a lot of times if they're crowded and I can get some type of an appliance in their mouth with the recommendation and guidance of Ortho Brain and then hold them until most of their primary dentition is gone and then bracket them. My goal is to always keep them in brackets for as short a time as possible. I just find that there's better compliancy. The hygiene tends to be a little bit better. I have less decalcification to deal with. So that's my approach with it.
Well, what you'll find is that after you've been in practice for 5 or 10 years, you'll find that people who are in step one, interceptive orthodontics, for an extended period of time, don't do the second step and finish it.
Oh,
It'll take you years to find that, but it's across the board. So most of my career, I educated orthodontists, looked at their metrics, measured everything, and we found that a lot of those step ones didn't do the step two because too much time was put into step one. So your approach has been proven over the decades to be the right approach in order to best serve your patients.
and I find too compliancy when they're younger, when you're asking them to wear a bulkier appliance or wear some type of retainer, it doesn't phase them as much as it does when they're 10, 11, 12. So that helps it a little bit too.
It is amazing, and our listeners probably don't realize this unless they're pediatric dentists. Little kids, they get excited about crutches, a cast, a sling, a patch on their glasses. These things are kind of cool for them, and that's short-lived. It certainly is the opposite by the time they become teenagers and have all their permanent teeth. I think that the genius that you have, Deanna, and I don't know where you got it, it didn't come from me because I don't remember teaching this, is that oftentimes as dentists, we get the whole thing exactly upside down and backwards when it's looking at who to treat. So many of the general dentists that we work with will say, well, I treat adults. I don't want to treat kids because they're growing. If they inquire, I'll say, well, it's more predictable to treat the kids because they're growing and the kids are
Right.
made of rubber. They don't tend to have the perio concerns and such. So the kids really have more predictable outcomes oftentimes than adults.
It's true. It's very, very true.
So over and beyond scanners, are there any other technologies that you implement or that you find really useful?
So I would also say we all know AI is coming in strong for sure. I can't really chat a lot about that, but I would say 3D printing is also huge because the things that used to take weeks to get back from a lab, I can have them back in 48 hours. So that's been a huge game changer in terms of dentistry as well, and just the ease of being able to practice. I had a case a couple of weeks ago where we did full mouth extractions. I shared the case with an oral surgeon in the area, and he did the extractions. The denture was 3D printed. It went right in. It was just a slam dunk. And I don't know if that would necessarily have been as quick or as efficient if it would have been the way the technology was years ago.
I love how you use the word and the concept of collaboration where you work with your oral surgeon. And I happen to have met your oral surgeon when I was up. And this is what I loved about her oral surgeon. If anybody in Sterling Heights, you've got to know about this guy. He came to an orthodontic seminar
He did.
to learn what the general dentists are learning about orthodontics. And I was so overwhelmed with the brilliance of him participating, because this is the whole idea behind OrthoBrain, is that specialists and general practitioners work collaboratively, that we hold hands and we do things better and we get better outcomes for our patients.
Exactly.
Everybody wins.
It's true. It's very, very true. And dentistry is constantly changing, but we either all have to support each other, or I don't know what the outcome is going to be if we don't. It's probably not going to be great, but that was probably the best advice my dad gave me. He said, spoil your patients, provide them with excellent customer service, and make sure you align yourself with specialists in those situations where you can't necessarily treat them, but make sure they're treated just as well by that doctor. So I really make a conscious effort when I'm working with perio or OS that they're exceptional and they're good to my patients.
Fantastic advice. I really admire how you have an open ear to your dad's coaching and that you paid attention to all that he was able to share. So I know that you're committed to education, right? It's obvious. You have a master's degree, you've won all these awards, you've done research. And I met you when you were a dental student. You traveled out of town in order to take a seminar on aesthetic dentistry, all right? Out of town. So I know you're deeply committed to education. What do you have in mind going forward? What are you thinking about in terms of the education that you want to pursue as you go through your career?
I've completed both of the OrthoBrain mini residencies. I would definitely recommend those to anyone. They're, first of all, very economical, very informative, and they're hands-on. So those are pretty much the big three things for me when I'm looking at CE. Currently, right now, I'm in the middle of Dr. Michael Gelb's TMJ residency, and I actually am headed out to see him in the fall to do a chairside course, which I'm really excited about. I would like to dive a little bit more into the oral facial pain, TMJ management, and then obviously the phase 2 correction once the TMJ symptoms alleviate. So that's my next thing. And then after that, I would say I'm in the process of studying for the AGD fellowship exam. So that would be the end goal, I think, for this year. And then I'll reevaluate for 26.
It's ambitious and terrific.
It is.
Yeah, as a former TMJ-ologist, when I was in practice, that was a huge part of our practice. And it was really nice to be able to provide the phase 2, the orthodontics that followed after going through the TM therapies, and how beneficial that was to patients, and a lot of the nuance that goes on with the orthodontics. It's a whole nother level of learning. So certainly spend some time together as you endeavor to correct the occlusions after you finish your therapies for TMD.
Yeah. And I'm excited. I mean, his course was excellent. It was pretty extensive in terms of the didactic part, which I appreciated. And then now I'm into the second part, which is talking about the airway centric occlusion, which is kind of a new twist on the traditional occlusion that we're taught in school. So I'm excited to see what that has to entail.
Yeah. I mean, it's one of the beautiful things about dentistry is there's so many different avenues of learning that you can pursue, and they're endless. You just study your entire career and you feel like there's so much more to learn. So I admire you for jumping in so quickly. I think a lot of folks finish dental school or maybe a residency, and then they just practice for a bunch of years and don't really pursue anything. And I think graduating from your school is really the beginning of your educational process to really pick up the skills and the knowledge that you need to be in practice. So can you give our listeners some advice, particularly those that haven't started any orthodontics? What advice would you give them? How do you get them comfortable that this is something that they could and should do?
So I think honestly, that's the great thing about ortho, right? And that's the great thing about being a general dentist, in my opinion, because you get to decide what cases you're going to do, right? You don't have to do surgical exposure cases. You don't have to do crazy misalignments, major diastema closures. You don't have to do any of that. You could do very simple liner cases and see how that goes for a few months and then transition into something a little bit more challenging if you choose to do that. But I think the fact is there's this new concept, at least the super GP. And I'm a big advocate for that because I think if there's great CE available, great support, why shouldn't you be able to do those things in your office? For me, I have all different types of cases going on right now. Some are very easy, some are a little bit more challenging. But knowing that I have Ortho Brain, knowing that I have Dr. Jeff, who, I'm a huge fan of him. He's on my team. We talk almost every other day about cases and things like that. Knowing that I have that in my back pocket, why wouldn't I try it? So I would tell anyone, just dive in, do that one case. And as soon as you see the outcome of it and how quickly things can go and the support that Ortho Brain provides you, you're going to think to yourself, why didn't I do this 10 years ago?
It's funny that you use the analogy of diving in.
Diving in.
I often use that expression, and here's why. For those of you who have ever taught children how to swim, how many PowerPoints do they take? How many YouTube videos do they watch? You can't learn how to swim by watching educational programs.
Right.
Same thing with a bicycle. You have to do it. Orthodontics is the same. It's learning by doing. And when you dive in, the idea behind OrthoBrain and practicing orthodentistry is you're not diving in alone. Somebody is right there at your side, an entire orthodontic team. I know you're very fond of Dr. Jeff, and he is an amazing, amazing doctor, a great, great man. And you've also interacted with a bunch of the other players on the team.
You're all absolutely tremendous. It just happened that he had a bunch of my cases back to back. So we kind of started to have this rapport with one another. But the level of education that Ortho Brain provides is just incredible. There will be Sunday nights where I'm thinking, okay, what do I have going on this week? What are my questions? And I can email him a list of 20 different questions. And within 24 hours, he'll have them answered. Do you need a phone conversation? He's walking me through the process to the general dentist to say, okay, these are my parameters. This is the case that I'm going to attempt. And then let's proceed.
Do you think there's any reason for mature, seasoned doctors to stay away, or do you feel that they would have the same experience?
No, not at all. I think if anything, they would probably have more to contribute because they have years of understanding occlusion and understanding restorative and perio components, and they've had more exposure. So they might even benefit even greater from it.
I'm really glad to hear that. And I'd like to dig a little bit deeper into some of your personal insights because you've been so incredibly successful. I'm wondering who it is that may have had the biggest influence on your philosophy as a dentist. Are there some folks out there that had a heavy hand in helping mold the way you are?
Sure. So I would definitely say my dad, obviously, number one. I mean, he practiced for over 40 years, started his practice from the ground up. And I just was with him for so many years, chairside. So I was able to experience firsthand how to properly treat patients, how to help them, how to listen to them, how to run a business. And then Dr. Gelb would be the second one for me to be able to sit through his class and have access to him and understand TMJ and craniofacial pain and have that exposure. He's really piqued my interest in wanting to learn more. Those people, they're struggling. They are in a great amount of pain. And typically by the time that they come to you, they've been to many different offices, doctors and whatnot, and they haven't been able to get any relief. So if I'm able to even provide that to someone throughout my career, that would be so rewarding.
Well, thanks for sharing all that. And along the same lines, are there some trends that you see in dentistry now that you find particularly exciting?
I would say, I know we talked a little bit about the 3D printing. I think that's pretty remarkable just in terms of collaboration, right? To go back to this patient that we were talking about, with one digital scan, I was able to overlay that with his radiographs. We were able to have a 3D printed surgical guide, which was amazingly helpful for implant placement that was done by oral surgery. And then I was able to use that same technology to 3D print him a denture that had excellent retention. So I think that is cutting edge at this point, and I can't wait to see where that's going to go in the next few years.
So it sounds like technology plays a huge role in your practice, whether it's scanning,
Mhm.
printing,
Yeah.
communications with your colleagues,
Yes.
the collaboration that you're doing with your orthodontics, all of that
Mhm.
is foundationally based on the digital revolution.
Yes. It just makes the profession so much easier. I think that the principles and the foundation of these concepts were laid many years ago, but now everything is moving so quickly. There's so many different opportunities, there's so many different materials that you can use, and it just makes things more efficient and it makes it more comfortable for the patient.
Right. Now, you have such a positivity mindset, and it's something I really admire about you. So you might not even be able to answer this. You might just say pass.
Yeah,
Is
sounds
there
good.
anything that's going on in dentistry that you're skeptical of, or that, let's just say, you're cautious about and maybe concerns you about where we're headed?
Mhm. You know, I would say I'm not a huge fan of those, what would you even call them? Like mail order, ortho companies, veneer companies, that kind of thing. Not speaking negatively about them by any means, but I just feel like I see more issues with patients coming into my office saying, "Oh, we did this, we spent so much money on this." And that really bothers me just because I feel like you're putting a lot of responsibility on the patient, and the patients don't have the capacity to navigate that on their own.
Just to follow up on that, it's so difficult to provide excellence in dentistry. As a dentist with a
Right.
ton of education and taking continued education and doing your best, it's hard to really create excellent outcomes.
It's true.
So I can see where you're coming from, and that whole thing must be astounding, shocking, and scary for your dad.
It makes me a little crazy because it's not like they're doing this for $5. It's a decent financial investment that the patient has to make with this. And then there's no support for this. The patient could be harmed or have some type of a reaction or a poor outcome with it. In reality, we can provide them with, I think, a more predictable outcome. And in terms of finances, you can work with the patient on that, right? There's different ways to do that. There's payment plans, there's care credit, there's all those types of things that can make it a little bit more attainable for them versus them going that route.
Yeah. Yeah. I want to ask you, of all the different things that you have done, can you name the accomplishment or the attribute that you have that has made your parents most proud of you?
Ooh, I think that they would say I'm a very determined individual. Getting waitlisted twice for dental school, I just refuse to give up. And if I thoroughly want something, I will do whatever I have to make it happen. And if I believe in something, I will fight till the end for it. So I think that they would say that for sure.
I'm sure you've made them very proud, and you- a whole lot of blue sky there for additional accomplishments and accolades. I want to ask you a really, really hard question. And please know that this has nothing to do with where you went to dental school. So I'm not asking what your dental school could have done better. What could we change about the way dentistry is taught that you think would make a big difference for students that are going through the system in the upcoming years?
So I think there's two things that come to mind when you mention this. One, I think we definitely need to spend some time teaching or at least discussing the business component of a practice. So practice management, right? You get a little bit of exposure to that in school, but they should do a little bit more, in my opinion, just so that the students understand the finances that are associated with running a business. And then I think the other thing too is just the practice of listening and interacting with patients and understanding what the patient wants, what their needs are, what the expectations are. Because I think developing those interpersonal skills make you successful, right? We're not working on typodons forever. That smile, once we graduate, is connected to a human being, or even when we're in preclinical, it's attached to someone. So you want to make sure that you have the interpersonal communication skills to be successful.
Yeah, it's amazing because one of the things that we hold dear to our hearts is that we're caring for precious patients.
Right.
And when I say caring for them, I'm not talking about the clinical procedure. I'm talking about the way we listen and interact with them, the way we provide the care, the how we do things. And I think so much of it is driven by our purpose and really love for all our patients and all the people that we're working with. And it's not the kind of thing that you can do, it's the kind of thing that you are. It's not what you do, it's what you are. And so
Yep.
I think that's why you've been a roaring success every step of the way. Really, what I love so much about your story is that you've never waited for permission. You found the way to get the right support and you started transforming lives in your practice from day one. You've got this mix of academic rigor, determination, humility, and a good sense to add collaboration with patient care. It's so well aligned with everything about orthodentistry. So, for our listeners, whether you're fresh out of school or you're 20 years into your practice, Deanna's first year success is proof that you can do orthodontics confidently and your patients will thank you for it. So, Deanna, I want to say thank you for being such an inspiration to so many of us, especially me, and making the time from your busy schedule to appear on our show.
Anything for you, Dr. Gurman. I absolutely love chatting with you and I love Ortho Brain. So it was a true pleasure.
Thanks for joining us on the Orthodentistry Today podcast. Remember, dentistry isn't just about teeth, it's about delivering holistic care to precious people with real lives. If you found value in today's episode, please subscribe, leave a review, and share it with your colleagues. To learn more and to stay updated on the upcoming Orthodontist Growth Summit, please visit orthobrain.com. Until next time, keep learning, keep growing, and keep transforming lives for good through orthodentistry.